Hi, my name is Crystal E. I am a general surgeon with Paragon Surgical Specialists. I joined last year, so I am fairly new to the practice. While practicing multiple faceted areas of general surgery, I do have a particular interest in hernias and specifically complex abdominal hernias. My training hails from New York. I did the past 5 years in New York City, and I joined the North Carolina population, and I'm super excited to be here. Surgery is unique for us in medicine in that it's one of those few fields that allows us to have quote unquote instant results. If a patient comes in with abdominal pain, for example, issues with their gallbladder, removal of the gallbladder does result in symptomatic relief, and that for me was very satisfying. And also the physical action of being more active in the patient's role, I think is what moved me to surgery. I think what was so great about my training in New York is that I did get exposed to everything. I was trained at St. John's Episcopal Hospital, which is a very indigent population, very sick. Did we get the opportunity to do laparoscopy with a lot of these patients? No, because they came in really sick. So I am very accustomed to doing open procedures, open gallbladders, open colons. But on the flip side, I've also been exposed to the nice, well-finessed procedures with robotics and laparoscopy. So it is a little bit challenging because we in training right now don't really get that exposure, admittedly, but I was very thankful to have gone to a training program which allowed me to really experience the entire facet of general surgery. I tell my partners, being fresh out of residency and being newer to the surgical world is great for me, and I think for my patients too, because I've been exposed to the newer technologies and the newer advances that we have currently in surgery. Right now, there is a great push for keeping everything laparoscopic, which means we go through with small incisions and cameras, and now we've even upped that another level by introducing robotics into the surgical world. And while robotics and laparoscopic surgery is kind of equivalent, robotics gives us a much better visualization of the field that we're working in. It gives us 6 degrees of movement when we are working with the robot versus 2 degrees of movement with laparoscopy. So our flexibility and our ability to do surgery is much improved. What's great about this surgery is that patients get to go home much sooner versus the traditional week in the hospital or whatever. We get you back to your normal daily life much quicker with these advances. So there are patients who are candidates for robotic surgery and admittedly patients who are not candidates for robotic surgery. And I think it's very important to know that there is differences in the population. For example, if you're not able to withgo general anesthesia, you would not be able to undergo robotic surgery because of what we need to do. If you've had extensive prior abdominal surgery with a lot of adhesions in the belly, that is going to preclude you from surgical procedure robotically. Your medical comorbidities, if you're a smoker, that kind of stuff. These are all things that we have to assess and make sure that we do the proper procedure for the patient. What's really great about Paragon Surgical Specialists is that we're a 7-surgeon group with multiple different concentrations of surgery all in one practice. So it's very easy for me to go up to one of my colleagues and say, hey, can I have you evaluate this patient for this and this? Absolutely, because that's their area of expertise. Being in the group with breast surgeons means I'm constantly being engaged in the breast world, even though I don't actively practice it. Being involved with colorectal surgery means I'm always being aware of that with surgical oncology too. It just keeps the practice very diverse, and it's kind of one-stop shopping for the patient themselves also, because you don't have to be referred to another discipline within the same surgical field.